Hey Long Beach! I hope everyone is doing well and staying safe. My name is Savoy and I'm with JCB Insurance Solutions. We assist with the mandated student health insurance. With this partnership, we thought it would be a good idea to discuss this year's insurance and go over some basic coverage details. And with that, let's just jump right in. One of the most common questions we receive amongst all of our students and scholars is, why do I need medical insurance? Now, the insurance is mandated by the university, and Long Beach requires you to have the school-sponsored plan. Insurance does help pay for your medical bills so that you pay less, and the U.S. government does not help non-citizens with medical bills. Now, let's take a look at the cost and coverage dates for this year's plan. Annual coverage will begin August 10th, 2020 and end August 9th, 2021. The student rate comes in at $1,297. The fall coverage period will begin August 1st, 2020 and end January 9th, 2021. The student rate comes in at $558.61. And for the spring-summer coverage period, coverage will begin January 10th, 2021 and end August 9th, 2021 with a student rate of $763.44. Now, insurance is purchased directly from JCB and coverage must be paid in full before any holds can be removed from a student's account by CSU Long Beach. Your insurance does not include dental or vision. Let's take a moment to review some common insurance terms. Some of you may be familiar with these terms already, but it's important to have a basic understanding as you will hear them quite often throughout your insurance coverage. Preferred provider. A preferred provider is a doctor or hospital who has contracted with Anthem to charge less money for treatment. You have less of an out-of-pocket cost when seeing a preferred provider. This is also known as in-network. Deductible. Now, the deductible is the amount you will pay each year before Anthem will start paying. Your annual deductible is $150. Copay. Copay is the amount you pay upfront for certain services. Doctor's office visits have a copay at $20. Emergency room has a copay of $150. Coinsurance. Coinsurance is the percentage of charges that you are responsible for paying. You only pay coinsurance when seeing a doctor who is not a preferred provider or out of network, or when getting certain medications. And then we have out-of-pocket maximum. Now, this is the maximum amount of money that you will pay in any year for your healthcare treatment. It's made up from the copays, coinsurance, and deductibles. Your out-of-pocket maximum for this plan year is $6,150. I wanted to give you a quick glimpse into the average medical cost here in the USA. One-day hospital room and board, including doctor's fees, can range anywhere from $3,000 to $5,000. 1 day in an intensive care unit, or ICU, can range anywhere from $10,000 to $20,000. Hospital emergency room visits usually start at about $1,000 going up. Treating something such as a broken arm would start about $4,000 going up. And then last but not least, delivering a baby is one of the most expensive things you can do, and that starts at about $20,000 going up from there. Let's take a look at this year's benefit summary. The annual deductible for this policy year is $150, both preferred provider and non-preferred provider networks. Your out-of-pocket maximum for the year is $6,150. Physician's office visit comes in at a $20 copay from a preferred provider. A non-preferred provider comes in at a 25% coinsurance. Inpatient hospitalization for preferred provider is 10% coinsurance. For non-preferred provider, it is a 25% coinsurance. Emergency room coverage comes in at $150 copay and then 10% coinsurance. And for non-preferred providers on emergency rooms, it is covered as in network, which is great. Prescription drug coverage comes in at a tier 1, 2, and 3 and is the same for both preferred and non-preferred pharmacies. It's a 50% coinsurance up to $250. This plan also has an unlimited benefit for medical evacuation and repatriation of remains. Okay, so you've bought insurance. Now what? ID cards are not available online until your insurance start date of August 10th. If you're a late transfer or enrollee at CSU Long Beach, your card may not be ready by then. Cards are electronic only. They will not be mailed. You must visit Anthem's website at www.anthemstudentadvantage.com to get your card. You may print your card from the site or save it to your smartphone. Most importantly, be sure you are showing your medical ID card whenever you are receiving medical treatment or services. Another common question we receive is, where do I go when I'm sick? And it's important to know you have a couple of options. Anthem has a 24-hour nurse line. This is free nurse advice, 24 hours a day, 7 days a week. They can be reached at 1-800-700-9184. You may visit the campus health center, or you may call the health center at 562-985-4771 to schedule an appointment. You can locate a preferred provider off campus, whether this is an Anthem doctor, urgent care, or emergency room, and schedule an appointment or walk in as needed. Be sure to show your medical ID card whenever you are being treated, and look out for your EOB or explanation of benefits within 6 to 8 weeks of treatment. Okay, so what happens after medical treatment? Now, most doctors will send your bills directly to Anthem Student Advantage. If you receive a bill directly from your doctor's office or hospital, please call Anthem to ensure they have received the bill as well. You're going to receive an explanation of benefits, or EOB, from Anthem, and this will show you what was paid to your doctor and if you have any out-of-pocket cost. If you do have an out-of-pocket cost, you may receive a bill from the doctor directly. Most importantly, make sure to pay your bills after confirming that Anthem has paid their portion. And lastly, I wanted to leave you with some basic contact information. If you have questions regarding the status of the bill, and last but not least, I wanted to leave you with some contact information. If you have questions regarding the status of a bill, your medical ID card, benefits, or claims, please contact Anthem directly at 800-888-2108. If you have questions about updating your contact information, viewing important plan details, or need assistance with your direct enrollment, you may visit www.jcbins.com or call 562-263-5180. Well, that's it for now, Long Beach. Thank you so much for your time. I hope you all have a great and safe academic year. Bye-bye.